Hi, my name is Justine McKinn. This is for my radiology class. What we're going to be talking about today is proper setup for the barium study of the upper GI tract. First, what I want to go over is why we would really even focus on the upper GI tract study would be to evaluate the stomach, small intestines for symptoms of like vomiting, regurgitation, possible foreign body obstruction, and chronic weight loss. Normally, before we even think about doing the barium study, what the doctor really wants to get, well, it's kind of actually doctor preference, would be to obtain plain radiology films first, so that way you can go ahead and compare the regular films and then also compare that to the actual barium films as well. To set up for the barium study, what you want to do for the animal is actually keep them fasted between 12 and 24 hours. Once again, it's doctor preference. Also, you want to go ahead and administer a cleansing enema to go ahead and get, like, stool and anything else out of the gut per se. And normally that's best to do it basically 2 to 4 hours before the barium study. Once again, that is doctor preference as well. Sometimes they do talk about sedating if needed. However, we don't do that here. The reason being the risk of aspiration is really high. So we actually do these procedures when they're fully awake, if the animal will cooperate. So some of the basic things that we have here are towels, for instance. We definitely like to use these for our kitty patients. The reason being, if we were to get barium and anything else, when you would take the radiograph, you could actually see the barium on other things, which is definitely not what you want. So you want to try to keep it as clean as possible when you're actually administering the barium. We have a bowl also to go ahead and put the barium in per se. Gloves as well, you definitely don't want to get it on your hands. Once again, like I said earlier, you definitely want to keep it as clean as possible. What we like to use are 60 ml syringes with little tips on them, so that way it's easier to administer the barium. And these are definitely easier for kitties too. You can actually get large amounts of volume of the liquid into the patient without constantly getting more each time. So it's actually pretty convenient there. This is the barium that we use here. Normally for a cat, it's going to be the 30% barium solution. For like a 10-pound cat per se, which I'm going to use a little bit later in the video, you want to go ahead and calculate the dose as 3 to 6 mLs per pound. So for a 10-pound cat, that would approximately be 60 mLs total to get started. However, here we actually have the 60% barium. So for instance, for a kitty, it would probably be about 12 to 16 mLs per kg. But really, in technical terms, what you really want is a 30% solution. And then we'll go from there with that. One thing that you do have to remember is that for smaller animals, you definitely want to use higher doses. And then as for like your bigger animals, like your Great Danes, for instance, you want to use lesser amounts of barium for the study. And then basically, once you actually have administered all the barium, you want to go ahead and take an x-ray right away. You want to go ahead and do that in a lateral view. This is Prince. This is actually the kitty that we're going to be using today. He's my little man, but we'll use him a little bit later. But like I said just a minute ago, is that you want to go ahead and take that x-ray right away. You want to get a lateral view and also a ventral dorsal view, so a VD view. You're going to go ahead and retake another one in about 15 minutes. Then you're going to go on to 30 minutes, 60 minutes, 90 minutes, and then you're going to do 1-hour intervals until the stomach completely empties and all the barium empties out into the colon. Alright, so now I'm going to go ahead and show you proper positioning techniques if we were to go ahead and do the barium study. This is Prince, he's my little man, so we're going to go ahead and use him today. So the first thing we're going to do is go ahead and do the measurements with the calipers. So we're going to go ahead and put him in lateral really quickly. So for him it is about 7 meters there. And then we're going to go ahead and put him in VD really quickly as well to get the other measurement. And that is about 9 centimeters. And if we were to do this, we would go ahead and program it into our system. However, like I said before, we don't actually have that here. We go based off the weight, so it's already set for us at 110 for KP and then 1.2 for MA. So another thing that you see is that we actually do not have the gloves here. We actually don't use them here, but we do have the rest of our equipment on, including thyroid shields and also our badges as well. So we're just going to go ahead and be very careful when we go ahead and do this. So we're going to go ahead and do the lateral and also the VD. So we're going to go ahead and get him in position here. And then you want to go ahead and focus upper GI. So you kind of want to make sure you get the stomach in there as well, and also the intestinal tract. Don't forget your marker, and this is going to be for a right lateral. And then you go ahead and click that. And then also what we're going to do is that you also want to do a VD position as well. And then go ahead and line them up here a little bit. And then this is for the right VD as well. Then you go ahead and click that as well.